All right, what we're going to do in this video is we're going to talk about the cardiac cycle. Now, what is the cardiac cycle? The cardiac cycle is all the mechanical events where the blood is flowing through the different chambers of the heart. And on average, it takes about 0.8 seconds. So what we're going to do is we're going to go ahead and go through each one of these hearts, right? And we're going to discuss the differences in the atrial versus the ventricular pressure. We're going to discuss the differences between the arterial versus the ventricular pressure. We're going to talk about what's happening with the AV valves or the atrioventricular valves. And then we're going to be talking about what's happening to the semilunar valves. SLV is for semilunar valves, so the pulmonary and the aortic. And then we're going to say at what part in each one of these stages, what will it appear like on the EKG? Which one of the components on the EKG would it be like? Right, so I'm going to draw here in green. I got to draw these guys. This is my pulmonary semilunar valve right here. And then this is my aortic semilunar valve, right? All right, so in the first event is defined as mid to late ventricular diastole. Now, what is meant by diastole? All right, diastole is defined as relaxation. So in other words, we could say that this is the mid to late ventricular relaxation. We're in the last parts of ventricular relaxation. So what's happening here? Well, what's happening here is blood is actually going to be returning to the heart. So some of the blood is actually going to be coming from the inferior vena cava. Some blood's going to be coming from the superior vena cava. If you remember, there's the coronary sinus. Some blood's going to be coming in there, right? Where else? Well, here's our pulmonary veins, right? I just drew one here, pulmonary veins. Blood's going to be coming in through these guys and dumping into the left atrium. So we got blood there's blood coming back to the heart. And what happens is these valves, the AV valves, whenever this blood starts accumulating in the atria from all these peripheral veins, like the pulmonary veins and the systemic veins, it actually starts opening up the AV valves because the atrial pressure is a little bit greater than the ventricular pressure. So if that happens, these valves open. So what valves open? The AV valves open. So this would be in this case, this would be your tricuspid valve between the right atrium and the right ventricle, and this would be the bicuspid valve or the mitral valve, which is in between the left atrium and the left ventricle. So those valves would open. And what would happen is passively, without contraction, a good 70 to 80% of the blood that's coming into the heart is going to passively flow down by gravity into the ventricle. So again, let's go over that real quickly. Again, blood coming from the systemic veins, the coronary veins, and the pulmonary veins are coming to the atria. The blood is accumulating in the atria, and the pressure in the atria is going to be a little bit greater than the ventricular pressure. So it opens up those AV valves, and about 70 to 80% of the blood flows down passively without contraction into the ventricles, right? So that's what happens there. So again, we kind of already defined what's happening here so far. So what's the atrial pressure? Is it greater than the ventricular pressure? Yes, it is. So the atrial pressure in this event is greater. I'm just going to put P for pressure, right? Here, I'll put pressure. I'll just write it. Is greater than the ventricular pressure, right? And because of that, the AV valves are going to open. Now, next thing. The ventricular pressure is still not, so the blood is accumulating in the ventricles, but the ventricles aren't contracting. They're just taking that blood in. What's going to happen is the ventricles are accumulating that blood, but the pressure in the actual pulmonary artery, or the pulmonary trunk, pulmonary arteries, and the aorta is still greater than the pressure in the ventricles. So these AV valves, they're not going to open. Remember, valves are one way, so they're going to allow blood to go out. They want to prevent blood from coming back in. So it wants to go out this way. So again, this pressure in the aorta and the pressure in the pulmonary trunk is going to be greater than the pressure in the ventricles. So if that's the case, these valves are going to stay shut. So again, what's happening here with the arterial pressure or the aortic and pulmonary pressure? The arterial pressure is greater than the ventricular pressure. And what would that mean then? Again, it would mean that the semilunar valves are going to stay closed because the pressure has to be greater in here to push them open. Because remember, the valves are going to open up like this. They're like this, right? You have to be able to push the blood like this up against these valves so that they can open up, so that the blood can pop through, right? So we want to be able to open up those valves. But in this case, the pressure isn't great enough. So the semilunar valves, like the pulmonary semilunar valve and the aortic semilunar valve, are closed. Now, on the EKG, it's extremely interesting. Now, if you remember, I told you in the first events when the blood's coming into the heart, 70 to 80% of it's passively flowing down. But then what happens is towards the last end, the late end of that ventricular diastole, the actual SA node starts firing. So if your SA node fires, it actually will produce this depolarization of the atria, and whenever the atria depolarizes, it contracts towards the late end, and that'll push the remaining 20% of the blood down into the ventricles. So if atria depolarizes, we know that from the EKG to show up as a P wave. So it's going to show up on the EKG with the P wave, right? So that's the first thing we know. And this is basically, we can also define not only the mid to late ventricular diastole, but this is the period of ventricular filling. Let's actually write that down here. So this is the period, we'll write it over here. This is the period of ventricular filling. Okay? So that's that first event. So this is the first part of the heart phase, right? So it's mid to late ventricular diastole. The second part of this is, let's go, what's happening now? Well, we know that the blood is already accumulating. Let's fix this inferior vena cava right here. So we know that the blood is sitting here, right? The ventricles have already accumulated some blood. And this is actually defined as the EDV, right? The end diastolic volume, which we'll talk about when we get into cardiac output. So the blood's accumulating there now. The atria have already supplied and opened up their actual valves to push the blood down. Now what's going to happen is the ventricles are going to start slowly depolarizing and beginning to squeeze and contract. If you remember the muscular layer, the cardiac muscle, the myocardium is going to start squeezing the actual chambers of those ventricles and start trying to push the blood upwards slowly. But what happens is we're going to name this phase. It's a very, very important phase. This phase is called isovolumetric contraction. Right, and you get to say systole if you want to, right? Isovolumetric systole or isovolumetric contraction. So what's happening? Let's actually denote this is that these little arrows pushing in is the myocardium beginning to slowly depolarize and contract. Well, you know, according to like a law, that as you start squeezing this, right? As you start squeezing these ventricles, the blood's going to start trying to move its way up and up and up. So what's going to happen here? As these ventricles start squeezing, the blood's going to start rising and getting ready to move up towards the pulmonary trunk and into the aorta, right? And again, here in green, here's my pulmonary semilunar valve, and here in this green is my aortic semilunar valve. And they're closed right now still. But the ventricles are really starting to squeeze. But here's where it's extremely important. The pressure in the aorta is naturally about 80 millimeters of mercury, right? Pressure here in the pulmonary trunk is usually about 7 to 10. So we're going to go just easy number, 10. Right now, the ventricles, these two ventricles, their pressure in these chambers are going to be less than the aortic pressure and the pulmonary pressure. Let's say it's on average, let's say this one's about 60, right? 60 millimeters of mercury. And let's say on average this one's about 7 millimeters of mercury, right? And this one's, again, this is 60 millimeters of mercury. Well, you know that this pressure is not greater than this pressure, and you know this pressure is not greater than this pressure, so it can't open up my semilunar valves, so those are closed. So again, what's happening to the semilunar valves in this point right here? They are closed. Let's actually draw like a division line down here so we can separate these. So at this point in time, the semilunar valves are still closed. But look what's happening. As we kind of try to imagine this diagram, the blood's moving up and up and up and up, and it's naturally pushing these valves. If you imagine it like this, imagine these two valves like this. They're open. And as the blood starts accumulating, it starts pushing these valves up and back together. As it starts doing that, what's going to happen then? This ventricular pressure is rising, and it's greater than the atrial pressure. The atrial pressure is going to drop. It's going to drop down to about 0 or 10. So let's just say 0 for the sake of it. 0 and 0 in here. Then that means that the ventricular pressure is greater than the atrial pressure. And if that's the case, then those valves should be snapping shut. So the AV valves, or the atrioventricular valves, are actually going to be closing shut now. So they're going to close. Okay. If they close, then now we can define the pressures, because the pressure are what determine the valves closing. So we already know then that the atrial pressure, it's not greater than the ventricular pressure, because we already said that the ventricles are higher than the atrial, so they close the AV valves. So that means in this case that the atrial pressure is less than the ventricular pressure. All right? And then we also know that if the arterial pressure, 80, 60, the arterial pressure is still greater than the ventricular pressure, and then 10, 7, look, this is still going to be greater than the actual ventricular pressure. So if that's the case, that's why the semilunar valves are still going to be closed. So this is the same thing here. The arterial pressure is still, at this point in time, greater than the ventricular pressure. All right, next thing. And I want to say this before I go into the EKG. When you're doing oscillation, right, you're listening to the different heart sounds. When you go to this point of this isovolumetric contraction, when that brief moment, no blood's leaving the ventricles. No blood is leaving the ventricles during this phase, right? Because the pressure isn't greater than the arterial pressure. The ventricular pressure isn't greater than the arterial pressure. So because of that, you're still going to hear a sound. Those AV valves are going to snap shut. When the AV valves snap shut, it's actually going to produce a sound, which is your first heart sound, and this first heart sound is called lub. So they call this S1, right, which is your first heart sound, and that's going to produce the sound lub. What we remember from this phase is that it was starting to contract. Well, guess what? It gets to the point, again, let's say that this one's about 10 millimeters of mercury, right? 10 millimeters of mercury, and this one's about 80 millimeters of mercury, right? The pressure within this left ventricle, it starts rising. And it gets up to the point to where it reaches about 120 millimeters of mercury. 120 millimeters of mercury. Now again, at this point in time, the AV valves are closed. Here, in the right ventricle, it's not a high pressure system, right? So usually a low pressure system in average, in healthy adults, right? And even adolescents. So usually it's not a high pressure system, but the pressure in here, it's only going to go up to about 24, 27. So let's say 27. All right, 25 is an easier number to remember, but it's about 24 to 27. So we'll say 25 millimeters of mercury, right? So if you look now, what's the difference? The pressure within the ventricles is greater than the pressure within the arteries, right? 25 and 10, 120 and 80. So the ventricular pressure is greater than the arterial pressure. Well, what's going to happen then? Things like to move from areas of high pressure to low pressure. That's how it works, right? So now when these ventricles squeeze, because what's happening still, they're still contracting. They're still contracting, and the pressure rises. Well, guess what? These valves are going to open and blood's going to move out. All right, so what I wanted to do real quick before I continue to keep talking is I know that sometimes whenever I was discussing about atrial versus ventricular pressure over there in the first phase, I know you guys might have been like, well, where is he going over here? So I'm just trying to make sure that we keep this same flow visible throughout all the phases. All right, so next thing, so we left off here, the ventricles are ejecting the blood out, right? Because the ventricular pressure here in both the right ventricle and left ventricle is greater than the arterial pressure for the pulmonary trunk and the aorta, right? So when that happens, it blasts open those semilunar valves. So these valves are going to open, right? And at the same time, we already know that if the blood is going up, the blood's still going to keep these valves closed, right? Again, what are these valves? These are the AV valves, or the atrioventricular valves, tricuspid, bicuspid, or mitral valve, right, for the bicuspid. So those valves are still going to be closed. So we're going to snap those closed, right? They're still going to be closed. And we already said that the ventricular pressure in both the left and right ventricle are greater than the arterial pressure within the pulmonary trunk and in the aorta. That's why the semilunar valves open. So in this one, we can say arterial pressure is less than the ventricular pressure, right? And then we know that the blood is still being pushed by the ventricles, and it's 120. In the atria, it's still almost about 0. So here in these left atrium and the right atrium, it's still almost about 0 millimeters of mercury. So these guys are still greater than these pressures here in the atria. So again, that's why the AV valves are still closed, because the pressure is greater in here than it is up here in these atria, right? So again, the atrial pressure is less than the ventricular pressure. So this phase, if you can kind of tell, it's all about blood being ejected out of the ventricle. So this is actually, we can call it, there's two names for this phase. It's called mid to late ventricular systole, right? But another way that they describe it is this is just the phase in which there is actually ventricular ejection. So it's the ventricular ejection phase also, right? So this is the ventricular ejection phase, or is the mid to late ventricular systole phase, right? And again, one more thing. If you think about it, the ventricles are still doing what they were doing over here in the second phase. They're still depolarizing, and they're still contracting. So it's going to be the same wave on the EKG here as it would be in this phase. So it's still going to be the QRS complex, or that QRS wave, right? So same thing in this one. All right? Now let's go into the last phase, right? So we're going to come over here. This is going to be our fourth phase, right? Now same thing. We're going to follow the same components here. We're going to do the same thing, so we're just going to keep it going here. So what's happened here? If we look at the actual heart again, we know that the ventricles have ejected their blood. Again, let's draw these valves. What's right here? This is going to be the pulmonary semilunar valve, and then right here is going to be the aortic semilunar valve, right? Now, if we look here, we know the ventricles have ejected the blood out, right? There's still going to be a little bit of blood left. That blood is actually called the insystolic volume, the blood that's remaining, after the ventricles have contracted. So that's called the ESV. And we'll talk about that when we talk about cardiac output. But a majority of that blood is out here, right? So it's out here. It's getting distributed now. So some of it's actually getting distributed out here to the systemic circuit, some of it's getting distributed out to the pulmonary circuit, right? Or even some of it's getting distributed out into the coronary circuit, which again, we talked about that in previous videos. So now, if that blood's going out there, that pressure here in the aorta and that pressure here in the pulmonary trunk, it's going to rise, because now it's going to accumulate all that blood, and that pressure is going to rise. So that pressure here in the aorta is going to rise very, very drastically, right? So it's going to rise out here, and it's still going to be, this pressure is going to be greater, the aortic pressure and the pulmonary trunk pressure are going to be greater than the ventricular pressure. Because another thing that happens is these arteries are very elastic, so they can stretch. So when they stretch, imagine it being able to stretch when the blood is coming into it. So imagine something like this. Imagine the aorta here, if you were to imagine it. And blood's coming into the aorta. It's extremely, and so is the pulmonary trunk, it's extremely elastic, but this is a low pressure system. This is a high pressure system. When the blood moves in here, it can actually expand a little bit. It can actually accommodate, or it's very compliant or distensible, so it can actually take on that high pressure. When it does that, it can recoil the blood down, right, until it go all the systemic circuit or up to supply the head and the actual upper limbs, right? But what happens is some of the blood can actually go down. Some of the blood can try to go back. And when it goes back, it snaps this valve closed. The aortic semilunar valve, same thing. This guy is going to stretch. If this guy stretches a little bit, again, it's not a very high pressure system, but imagine it stretching. It's going to recoil the blood out this way, recoil it out this way, but a little bit is going to come back, right? So the pressure in the aorta and the pressure within the pulmonary trunk are going to rise, become greater than the pressure within the ventricles, and snap these semilunar valves shut. When you look at a graph here, and I'll show the graph after, there's going to be a brief rise in aortic pressure right here. They actually call it the dicrotic notch, when there's that brief rise in aortic pressure, because it snaps that semilunar valves closed. So again, what's happening here? we already discussed it. We know that the arterial pressure, if we come over here and we try to follow it, we know that the arterial pressure is going to be greater than the ventricular pressure. So arterial pressure is greater than the ventricular pressure in this state, right? So if that's the case, and again, we already discussed it, there's going to be the brief rise in aortic pressure, dicrotic notch, and it's going to cause that drop of the blood to come back down, snap those valves closed. And so that means that the semilunar valves are actually going to snap shut. So then the semilunar valves are actually going to be closed, right? Then, if you think about it, what happens here is the ventricle pressure is still a little bit greater. It's going to be going down and down and down. But the atria is still going to be, at this point in time, it's still going to be 0. So it's still going to be 0 at this point in time. Very, very low pressure. But the ventricular pressure is still going to be great enough to be able to be greater than the atrial pressure. So if that's the case, we know that the ventricular pressure is still greater than the atrial pressure. Or we can rewrite it this way. The atrial pressure is still less than the ventricular pressure. Right? Still greater than the ventricular pressure. So if that's the case, then the ventricular pressure is still greater. Well, then because of the pressure differences and pressure gradients, these valves, the AV valves, are still going to be closed. So the AV valves here are going to be closed. Now, if you noticed, we're coming back to what we hit in the second phase. Both the valves are closed, and it's only a brief moment in which all 4 valves are closed again. If you noticed before, if we come over here real quick, if we noticed when the actual AV valves closed in the isovolumetric contraction phase, it produced a lub sound. Well, now, if we come back over here, look what happened. The semilunar valves snap shut, right? And if the semilunar valves snap shut and they're closing, it's going to produce another sound. That is going to be the second heart sound, and that's going to be referred to as dub, right? And that is S2. Now, this phase is going to be just like the second phase. We actually define this phase as the isovolumetric relaxation phase. Because the ventricles are beginning to go into diastole, they're beginning to relax, the coronary arteries are getting filled, the blood's going to the muscle so that they can get the oxygen it needs, right, in order to be able to produce ATP and undergo contraction. So for the next cycle. So in this part, the ventricles are, what did I say? It's that the ventricles are relaxing. So in other words, the ventricles are repolarizing. If the ventricles are repolarizing, if we go back to remember what the EKG said, EKG for ventricular repolarization is the T wave. So again, this last part of the EKG here is actually going to show up on the T wave. So that describes basically what's happening here with all of these, right? So if you think about it, right after this cycle, what's going to happen? Right when this ends, the ventricles are going to the relaxation, the blood's getting distributed to the pulmonary, systemic, and the coronary circuit. Once it gets distributed, guess what's going to happen? Let's come back here. It's going to go all the way back over here to where the ventricles are getting to the mid to their late part of their relaxation phase, and they start filling again, and the cycle continues again for another 0.8 seconds, right? So that right there describes the cardiac cycle in a nutshell.